Hey guys, this is C. Allen, better known as Chef Benne in the Kidney Cafe. When I tell you I'm excited for this next episode of Kidney Conversations because we have back live in studio. I've told you we're going to continue this conversation on kidney disease with Dr. Melancon, and I'm excited because he is the chief at the George Washington University Hospital Transplant Institute and the medical director at the GW Ron and Joy Paul Kidney Center. And listen, you know, I'm a patient there. I go there because of my kidney transplant, but I want to make sure that we give him the proper credit, and we are just really excited that he was allowed to continue to stay with us so we can continue our conversation. Let's give him a big hand. We're really excited. Yes. So, Doc, I'm going to go directly into a lot of the questions that we weren't able to cover that I know that we can get through. So my first question is, when your kidney function is at 46% and you only have one kidney, what type of lifestyle change should one make?
That's a very good question. So if you only have one kidney, you're at 46%. Then you're already down to, there are 5 stages of kidney disease. So you're already in stage 3. However, that's not end-stage kidney disease. So you don't need dialysis, you don't need a transplant, but what you need to be doing is making sure that you keep that portion of your kidney function working well. How do you do that? Well, you got to make sure your blood pressure is normal. And normal would be top number under 140, bottom number 80 or lower. Okay, so that's number 1. Number 2, you need to be keeping your body healthy. So your kidney is part of your body. So everything you're going to do to keep yourself healthy, you're going to do to keep your kidney healthy. You should make sure you're not developing diabetes, which we have an epidemic of diabetes in this country, type 2, and that primarily comes from people being overweight and eating too many sugary foods. Corn sugar is basically in everything, and that's why we need to avoid it. You need to be reading recipes. But if your blood pressure is normal and you don't have diabetes and you're not, overweight, then those are the things you need to be doing to keep that kidney healthy. And then you need to be checking in with your primary care physician at least once a year.
Okay. Now, she goes on to say, in addition to kidney concerns, there are heart issues as well. With these 2 very serious issues, would a 72-year-old diabetic, overweight male be eligible for a kidney transplant? Let me read that again. In addition to kidney concerns, there are heart disease issues as well. With these 2 very serious issues, would a 72-year-old diabetic, overweight male be eligible for a kidney transplant?
The short answer is yes, because we see this so often. These diseases run in tandem: diabetes, heart disease, kidney disease. They all go together. So that conglomerate, we see that a lot in transplant. However, not necessarily so. So the patient would need to be working with us. We're going to make sure that you can have heart disease, but there are gradients of heart disease. So you can have a little bit, even a moderate amount of heart disease, and still be a good surgical candidate. You could be overweight. Again, we take people up to a BMI of 40, and 40 means, you're almost 100 pounds overweight. So you could be that big and still get a transplant. And diabetes, many of our patients have diabetes because it's such a major cause of kidney disease. So yes, you could have that constellation of symptoms and be a candidate. Everyone that needs a kidney transplant should come in and at least be evaluated. Let us tell you no. If we tell you no, then so be it. But you should at least be evaluated. The age, 70, 80, I've done people well over the age of 80. So 70 is not a problem.
Okay. Is there a cutoff age, which we kind of just talked about, to receive a kidney transplant?
There is no cutoff. I tell people all the time, patients, that you have physiologic age and you have chronologic age. I think in one of your future shows, you're going to have the great Dr. Calendar.
Yes.
He is, physiologically, he's a man barely over 60. although chronologically he's over 80. So I would operate him on a heartbeat. He doesn't need an operation. But the point is, it's how healthy you are. You could be well over 90 and still qualify to get a transplant if you are healthy.
And then we kind of talked about this in a previous show, but what are some of the symptoms one may have to let them know that their kidney is failing?
Yeah, so I mentioned earlier that unfortunately people present with end-stage kidney disease, meaning that they never saw a doctor, and when they first go to the emergency room because they feel bad, they find out they have kidney disease. What are the symptoms? The symptoms are going to be like things like swelling. So your ankles start to swell, your legs start to swell, you start to have trouble breathing. That's all from the fluid building up in your body. So that's one sign. Bad headache. That's because the blood pressure is building up so high, it's giving you a bad headache. Really high blood pressure can even make your vision change. These are really bad signs, and you need to go to the emergency room. People can have itching. They itch a lot. That's because the toxins, the proteins and such that we get in our food are building up. Their skin can change character, become dry, scaly. For African American people, they start to get darker. These are all signs of kidney disease, and you need to go to the emergency room if you have these symptoms because, like I had said earlier, it doesn't take long for you to have really bad kidney function, and you could have a heart attack and die pretty quickly.
And you know what, and not to do a shameless plug, but that's one of the reasons why we created at the C. Allen Foundation, we created the body butters, we created lotions, soap. And the reason why is because I noticed myself when I had kidney failure, kidney disease, my skin became very dry. Not only did it get darker, but it became very dry. And I felt bad being in the center in the chair with my feet looking like I was kicking the flour. So one of the things that I did was we created the products, and we're gonna send some home with you today, but we created the product for excessive dry skin and people that are living with kidney failure on dialysis. So I just wanted to put that out there. Now, another question is how long can one be on metformin for diabetes?
So things like metformin and these oral medicines for diabetes, you can take them for a long time, but you have to be careful because although you want to treat diabetes, absolutely, when it needs to be treated, it has to be treated. And what does that mean? That means that your blood sugar should normally never be above 120. If it's above 120, then it means that you have to do something to get it back into a normal range. So things like metformin will do it. You have to be careful when you're taking medicines like this because after being on them for a period of time, they can affect your kidney function. So that's why you have to be under the care of a doctor, and they need to be consistently looking at your labs to determine that you're not developing any problems on these medicines because they can be interchanged. Now there are lots of oral agents that you could take other than metformin to treat diabetes. And, I know people hate that. The idea that they would have to take insulin. But sometimes if you're taking a lot of oral medicines and your blood sugar is still not under control, the treatment is going to be the needle. You're going to need to get insulin. Now, what's the alternative? The alternative is to lose weight. Most people that are diabetic because they have what's called type 2 diabetes. And when you have type 2 diabetes, your pancreas, which makes insulin, is making a lot of insulin. The problem is that your body is resistant to the insulin because you have too much fatty tissue. And it doesn't mean, people think, oh, well, I'm not really big overweight, so it can't be me. No. It just means you have too much fat in your body. You may not look that big, but you have too much fat in the wrong places. That's what type 2 diabetes is. So the treatment is to lose it, to become more active, to utilize that glucose that's in your blood by moving your muscles. If you do that, your sugar will come under better control and your diabetes may go away. People lose 10, 20 pounds, were told they were diabetic, and then they're not diabetic anymore. So losing weight is a big part of that.
Which is perfect. This is a perfect time for us to take a break, but I just want to say, which is really, being transparent, that whenever I go to the to the George Washington Transplant Institute, and when I go into the GW, Ron and Joy Paul Kidney Center, 90% of the time my numbers are really great. The only issue that I personally have is my sugar numbers, my diabetes numbers. And what I realized, like yesterday, I did 6 miles. What I realized is the more that I walk and jog, and the more that I just walk, I realize how normal and stable my numbers are becoming. And I do have to do a needle in the morning and a needle in the evening, but I notice that the more that I work my muscles and my body, the less I have to use it because I'm starting to really look inside here. So before we go to break, I want you to remember the purpose of Kidney Conversations is to bring awareness, to educate, and also inspire you to change your situation. A lot of us in the African American community, especially, we have issues, and we do, especially when it comes to eating. And a lot of times, it just could be just the situation and the environment that we're in, the location that we're in, that we may not have the kind of foods, the fruits and vegetables that we may need to keep our body running. However, we can take matters in our own hands and do small things like walking 30 minutes a day will help out tremendously. So we're going to take a break, and when we come back, I want to know, a question came to me that was great about if you're on dialysis, can you drink wine? So we're going to get that and much more, and I want to know a little bit about liquor when we come back. So this is C. Allen here, better known as Chef Benne. We're going to take a break. When we come back, we have Dr. Melancon live in studio, so we'll be right back after these messages. Okay. Welcome back, guys. Yes, we're excited. Thank you. All right, guys, welcome back to Kidney Conversations with Dr. Melancon live here in studio. And so we really want to get into some more pertinent questions. I want to talk about alcohol for a minute. So one, I want to talk about, Doc, my first question is for someone on dialysis. They want to know, is wine okay for them to drink? And then my second question is people who are post-transplant, when it comes to alcohol, what's your recommendation?
Yeah, we really don't have any issues with alcohol other than overindulging. So it's obviously never good to overindulge to the point of intoxication, but you can drink while you're on dialysis as long as it fits into that amount of liquid you're supposed to consume between dialysis times. After transplant, we definitely don't have an issue with drinking alcohol. The only issue is certain types of alcohol, like red wine, can interfere a little bit with some of the medicines, but usually it's a mild interaction. So for the most part, you can drink alcohol without any issues. Remember, Jesus' first miracle was to turn water into wine.
Amen, amen, and amen again. I think that, and I'm not going to take a lot of your time today, because I think that it's probably the Lord telling me to stop, because every time I try to get a drink, instantly, or not, I'm not going to say instantly, but before the evening is over, it comes out. So I don't know what that could be, but it just comes out and it just tells me, Chet, you don't need to drink anymore, because I just can't keep it down. So, but my next question is, I want you to tell me, how many transplants have you done? Let's talk about that. Let's talk about transplants. How many transplants have you done?
Well, currently at our program, we do about we're between 75 and 100 kidney transplants per year. In my career, I've been a transplant surgeon since I finished my residency in 2002 and then became a full-time transplant surgeon in 2004. So I've done, almost 1,000 kidney transplants in my career because I've been very busy. But yes, I've done lots of transplants. I believe it's the least stressful thing that I do. I have to do lots of meetings, lots of administrative work, but I'm happiest listening to music and operating in the operating room. And I do those things together.
Oh, okay. So when you was working on me, you had music playing.
Yeah, I was listening to spiritual music when I was operating on you, Chet.
Amen. Very good. So now tell our audience about what is a cadaver kidney and why doesn't it last as long as a living donor?
Yeah, so the best type of kidney transplant to receive would be, like you received, would be one from a live donor. The advantage is that when you get a live donor transplant, we take it out and we put it immediately into your body. So it's only about an hour between it being removed from the donor and then going into your body. That's a big advantage. When you receive, like you said, a cadaver, we call them deceased donors, but basically someone that's died and then you get the kidney, oftentimes that's coming from across the country. So that kidney, although it's life-saving, it's being placed on ice, it sits on ice for a period of time, and then it gets transplanted many hours later. It's still very, very good, much better than dialysis, but the life expectancy between getting a deceased donor versus getting a live donor can be 5 to 10 years longer. So if a deceased donor kidney, we say the average now is about 15 years, the average for a live donor is going to be well over 20 years. And we think that those life expectancies are only going to increase, but there is a big difference. The best type would be a live donor.
What are some complications of a kidney transplant?
Well, the major complications are going to possibly be the surgical complications that could happen very early. However, that's not what most people are going to have problems with. The biggest issue with a transplant is going to usually be based on the medications. We have to give people medicines to keep their body from rejecting the transplant. So that pushes back on your immune system a little bit. Therefore, it can increase your risk of infection. That's the major thing, or even malignancy. So there are certain things that transplant patients need to be mindful of. And particularly in this time of COVID, you need to be washing your hands religiously, wearing the mask when out in public because of viral infections. The good news is we've seen infections go down in our patients just recently because everybody's being so much more cautious because of COVID. But infection is going to be the number one problem. The second issue is, like I said, cancer. So what does that mean? Particularly if you have fair skin, you need to be covered up when you go to the beach. You need to wear a big hat if you're outdoors. I don't know if you have a green thumb, Chet, but you have to be careful when you're out there with the tulips or whatever, and you need to wear a big hat because the sun can cause you to get skin cancer. And then there's a slight risk of other types of cancers. But the good news is, over time, the medicine that you're on, we actually decrease the potency of it. We decrease the dose, and that decreases the side effects. The major issue that our patients have are the side effects of the medicines, but they decrease over time.
Very good, very good. So what would be your advice to people who say that they've been on a transplant list like for 7+ years? The question is, my sister has been on the list for over 7 years. Why hasn't she been transplanted?
It's a good question because, depending where you are in the country, your wait time for a transplant is different. So the bigger cities, usually you have to wait a little bit longer. Now, luckily in the DC area, we're not as bad as, say, the New York area or San Francisco or Los Angeles. The wait times in those areas could be well over 10, even 15 years to wait for a kidney transplant. And remember, I told you that most people are going to survive only between 5 and 8 years. So most people, unfortunately, that are waiting for a transplant will never receive it. In the DC area, the average wait would be around 5 to 7 years. So someone that's still waiting at 7 years, like the question that's posed, that's a little long. So I would call the transplant center and ask, what is it in particular that's making this person wait? Usually there's a good reason, like if you're a woman and you've had many children, the proteins can build up in your body that makes it more difficult for you to receive a transplant. And if you've had blood transfusions, things of that nature. But 7 years, that is a little long. If they're here in the DC area, they should call and try to find out exactly what the reason is.
The final question for me, and then we're going to open it up to our audience with two questions. Well, one is, a lady had asked, how many times can a person get a transplant?
There's not really a limit. It's not like we have a number limit, but the more surgery you have, the more difficult the next one will become. My personal record is to have done 5 transplants in one person. So there is, like I said, there is no set number, but once you get beyond 2 or 3 transplants, it becomes very difficult to transplant the person again.
Okay, so my final question, and then we're going to go to the audience. My final question is, we have students at the Bennett Career Institute, the school that I own, where the majority of the population is between 18 and 30. What kind of advice would you give them to not go down the road of kidney disease? What could they do today, right now, this day, to continue to try to make sure that they stay healthy and stay away from kidney disease altogether? What would you tell them?
The major thing is really you should get a physical every year, if possible. If that is, but I understand that sometimes people have insurance issues, and therefore that might be an issue. But if you cannot go to see a doctor every year, at the very least, what you should be doing is just take your blood pressure. You can go to one of the convenience stores and take it there, or you can actually buy now they're very, very inexpensive, a blood pressure cuff. For less than $20, you could go to a drugstore and purchase one. I have one at home, and I place it, and you press a button, and it takes your blood pressure. And you want to make sure your blood pressure is in normal range. A lot of the people that I see that have kidney disease, it started when they were young, 18, 20 years old. So if you want to check and make sure your blood pressure is normal. What is normal? That top number needs to be less than 140. The bottom number needs to be less than 80. If it's not there, you need to get that addressed. Now, in that age group, the problem is a lot of times they may get diagnosed with high blood pressure, but particularly for men, one of the major things that happens to young men that take blood pressure medicine is that it can make them impotent. So guess what? They don't want to take it, but that's okay. If a medicine is giving you a problem, we now have so many options, we can switch it out and give you another one. What you don't want to do is just stop taking the medicine and then don't go back to the doctor. What you have to do is go back, let the doctor know, yo, look, I have this problem, I need another medicine. And we can change it out. There are lots of different options, but the key is to take your blood pressure. The other key is not to become addicted to junk food. I realize that's tough. One of my kids loves Chipotle. He wants to eat it every day. But junk food is a problem primarily because it has a lot of sugar, processed sugars. It has a lot of salt. Salt can be a problem because it drives up blood pressure for anyone, but particularly for people of color. We tend to be more salt sensitive, and we eat too much. And, one of the things I see in the cafeteria, which I hate to see, is people adding salt. Our food already has too much salt, and then you have people adding salt. You should add pepper. I'm from Louisiana. Pepper is good for you. Salt can kill you.
Perfect. Okay, so at this time, what we're going to do is we're going to go to the audience to see if we have any questions. If you have any questions, we want you to go to the microphone. Please state your name clearly and then ask the question to our guests.
My name is Michelle, and my question for you is, do you have to be under the care of a PCP at the time of coming to your center? Do you have to receive a referral from your PCP in order to get care at the center?
It's a very good question, Michelle. And the answer is no. You do not have to be under the care of a physician, a primary care physician, in order to come to us. All you have to do is call to make an appointment. The number for our center is area code 202-715-4225. If you are a kidney failure patient, all you have to do is call. They're going to ask you a bunch of questions, but you don't have to be under the care of a physician already. Most of our patients are, but you don't have to be.
Thank you.
No problem.
Do we have any more questions? Okay, make sure you state your name and then speak clearly so we can hear you.
My name is Ruth Alexander, and my question is, I know you had spoke about the urine, seeing suds in the urine. What color of urine we should be looking for at all times? Because sometimes it come out different colors.
Very good question, Ruth. So the color of urine can vary, but a normal urine color would be very, very pale, almost clear, or maybe a little darker than that, maybe a little like a amber color, like the color of like a Pilsner beer. I don't know if you drink beer, but that would be normal, like a light yellow. If it's darker, if it's like a dark brown, and particularly if it's a different color, like rose color or red, that is abnormal. Normal should be clear, almost like water, amber color, maybe a little yellow. Sometimes our urine can get more concentrated, particularly the first urine you make of the day. So when you get up in the morning, it's normal for that urine to be a little bit darker than urine you make for the rest of the day. So that's the color answer. The other issue is, like I said earlier, if there's a lot of suds, that's an issue. Now, again, the first urine you make of the day can be more concentrated, so it's also normal that you might see a little bit more suds in your urine, for it to be a little more foamy when you make that first urine in the morning. Over the rest of the day, it should not be that foamy. If you have a lot of foam in your urine all the time, that is also not normal. That means you have a lot of protein in your urine and it needs to be checked out. But your urine should never be a color other than yellow or clear. And particularly if it's like getting close to like a really, really dark, like black color or a red color or a rose color, it means you probably have blood in your urine. And that always needs to be seen by a physician, and it needs to be checked out.
Okay, thank you. I have one more question.
Yes, ma'am.
What about your stool?
So again, your stool can change in color with what you eat, which is okay. But typically, it should be brown or dark brown. If it's really, really light in color or really, really dark in color, those are two problems. So a really dark stool means that unless you've had a particular type of food that can make your stool dark, like some beets can make your stool like turn reddish or even dark. That's okay. And that should change with your diet. But if it's consistently dark, it means that you probably have blood in your stool, which can be a sign of cancer, and that needs to be checked out. Now, I don't want to alarm anyone, because usually when you see streaks of blood or even dark stool, there's a more benign cause for it, like maybe hemorrhoids, but it still needs to be checked out by a physician. If it's really light in color, that is a sign that you could have liver problems, like liver disease, and that also should alarm you so that you can get that checked out.
All right, thank you.
Yeah.
Well, we thank our audience today, and I am so grateful that we've had this opportunity to sit with the doctor, the one. And let me say something. And the funny thing is, I know we have to go, but I got to say this. So they had asked me to speak at the George Washington University Hospital Transplant. And I don't know what event it was, but I got up and I said, because, I'm a fan of President Obama and I'm a fan of Dr. Melancon. So my first thing when I got up there, Sherry, I said, everybody, isn't the doctor he's our Obama? And everybody was looking at me like, they was all looking at me like, well, oh, you said that to say what kind of thing? But I said that to say, and I want to get it clear that, because I believe that Dr. Melancon saved my life through his magical hands, through the Holy Spirit, to give me an opportunity to live longer. I wanted to really say how much I really appreciate you, Doc. It wasn't just the transplant surgery, but it was just the interactions from the day that I met you until today. You have been consistent in reference to being knowledgeable and having a passion in what you do and leaving an impact on everyone that you work with. From every hospital, everyone who knows you, they all say the same thing. So I think it's a gift as well as a blessing. So I want to take this opportunity to thank you so much for coming on Kidney Conversations. And for those of you who are out there, I'm not trying to be biased, but the GW Ron and Joy Paul Kidney Center, the Transplant Institute, would be my highest recommendation if there's any issues. That number again was 202-715-4225, right? 4225. I should know it by heart. 715-4225-202. Give them a call. Find out how can you come in. Just do a routine check just to see where you are. And those of you, we're not talking against any other place, but the best success that I've gotten was at the GW Ron and Joy Paul Kidney Center at the George Washington University Hospital Transplant Institute. So we thank the doctor, and we hopefully, I know we're going to see him again. Where? On Kidney Conversations. Until then, make it count. Have a great day, everyone.